Hi, Dr. Tedder here with Upper Cervical Chiropractic, and if you're watching this video, you clicked on it because it says pinched nerve. So you possibly, or somebody you know, is suffering some sort of pain or discomfort from a pinched nerve, whether it's in your neck, whether it's in your back or your lower back. And I want to talk to you about how upper cervical care can help that, because I'm sure if you're like all the other patients that come in my practice, you've tried everything. You've massaged it, you've put ointments on it, you've taken pills, you've had a chiropractor, you've had a physical therapist, you've done everything, and you really can't figure out what the heck is going on. Well, I gotta tell you right now, most people have a pinched nerve, even if it happened yesterday and you never had a problem before, or you've been suffering from it for years or months at a time. It's usually an underlying effect on the inside that then something triggers on the outside. So what do I mean by that? I would say 9 out of 10 people that we look at and analyze that they've had a bone at the top part of their neck out of alignment. We call that a subluxation. How that creates a pinched nerve is this, is that your head literally sits on top of the bone. So if I was to use a model right here, this is the back of your neck right here, here's your head. Your head sits on top of this bone right here, and it cradles in there. So wherever this bone goes, it takes the head with it. So let's say you had a fall, let's say you had a car wreck, let's say you slept funny, let's say you got in a fight, let's say there's a chemical trauma or a severe emotional trauma, and it causes the bone to shift out of place just like that. Boop. When that bone shifts out of place and gets stuck, 98% of the time, you fix yourself. Your body will fix it. However, in some cases, 2, 3, 4% of people in the population, this bone gets so unstuck that it gets so stuck it can't unstick itself, and two things occur. The first thing it does is it takes your head off center just like that. See how that bone is, boop? It basically is going to take the head off center. Well, your brain cannot work that way, and so what it's going to do is it's going to tell your body below to twist, turn, and rotate, whatever it has to do to get your head level again. And when it does that, it's going to cause a crooked back. Well, the problem with that is if the back is crooked instead of straight, the little nerves that come out of your back, they get pinched. Okay, and you don't feel that right away, and so then you go have a good night's sleep, you turn your head, the muscle seize up on you, and it makes that nerve inflamed, and now we've got a pinched nerve. All to the fact that the bone is out of alignment here, so if you go and get a physical therapy rehab, if you go massage that, if you put an ointment on it, it's not going to fix this. And so what has to happen is you have to have a very specific set of x-rays done and measure to the exact degree that the bone's misaligned. There's 274 ways that bone misaligns. And so you've got to have a very analytical approach to that. You also have to have a corrective process to get that bone back into its normal position and restructure it so it begins to hold and heal. Thirdly, you have to have a thermal scan or some sort of neurological graph system to measure if the nervous system or the pinched nerve is actually healing. In our office at Upper Cervical Chiropractic in Georgia, we do that. And so if you're suffering from a pinched nerve, I don't care where it is in your back, even if it's not in your neck, it could be the twisting of the back, it could be the shifting. And if you're looking to figure out the cause, give us a call. Call us, 770-614-9444, and we'll figure out, we'll have you sit with a doctor. We'll sit down and chat with you and figure out first if this is the right place for you. If it is, then we might recommend certain exams to then prove that you have that situation. If you qualify, we'll get you corrected. If you don't, we'll find another specialist other than us to take care of the problem for you. Thank you very much. Have a phenomenal day.